Hi everyone! Today we're going to talk about neurological diseases and disorders. There are over 600 distinct diseases that affect the human brain. Some of them are pretty common and familiar to you, like Parkinson's, Alzheimer's, and Huntington's. However, there are a few neurological diseases that are rare and complicated, which makes them super fascinating for scientists and students. The diseases we're going to talk about today have some of the strangest symptoms in all of medicine. While it's very important to study more common diseases that affect millions of people, like Parkinson's, it's also important to study the diseases that might only affect a few people each year. These diseases tell us about the specific functions each area of the brain controls, and also point to how much we still don't understand about the brain. The first disease we're going to talk about is called Creutzfeldt-Jakob's disease, or CJD. CJD is a rapidly progressive neurodegenerative disorder, which is always fatal. Most people infected with this disease die within 1 year of symptomatic onset. CJD affects an average of 1.5 per 1 million people per year. In other words, in the United States, there are about 350 cases of CJD per year. CJD is something known as a human prion disease. It belongs to a family of diseases known as transmissible spongiform encephalopathies, or TSEs. TSEs are characterized by the spongy appearance of infected brains. The brain tissue becomes filled with holes, which results in a sponge-like appearance under a microscope. There are three main categories of CJD. In sporadic CJD, the disease appears even though the patient has no apparent risk factors. This random occurrence of the disease accounts for about 85% of all cases. In hereditary CJD, the patient may have a familial history or genetic marker for the disease. This form of CJD is much rarer, accounting for only 10 to 15% of all the cases in the US. Lastly, acquired CJD occurs when the disease is transmitted through the exposure to the brain or nervous system tissues. A variant of CJD, or VCJD, can be caused by eating the meat of cows that have been infected with a similar disease called bovine spongiform encephalopathy, or mad cow disease. Acquired CJD accounts for less than 1% of all cases ever diagnosed. It's important to note here that CJD and variant CJD are not exactly the same disease. CJD is not related to mad cow disease, although this is a common misconception. VCJD is much rarer, especially in the US, and has slightly different symptoms and progression rates. The trademark symptom of Creutzfeldt-Jakob's disease is rapid dementia, or memory loss, but this is not usually the first symptom to appear. Typically, patients experience drastic personality changes, impaired vision, and problems with muscle coordination. These are all consistent with damage to the frontal lobe of the brain, although it's not confirmed if the disease starts there. Patients may also experience psychiatric symptoms like depression or insomnia. As CJD progresses, dementia sets in, and patients may go blind or develop involuntary muscle jerks called myoclonus. The end stage of the disease is characterized by loss of ability to move or speak, and patients usually go into a coma. Death usually occurs because of pneumonia or other infections. CJD is not transmissible between people. There is no real treatment for CJD. This disease is 100% fatal. There is no record of anyone surviving ever since the disease was first diagnosed in 1920. Any treatment usually focuses on keeping the patient comfortable as the disease progresses. Additionally, CJD can be very difficult to diagnose. The only way to confirm a diagnosis of CJD is through a brain biopsy, which involves taking a piece of live brain tissue for testing. This can be unnecessarily risky. Or CJD can be diagnosed through an autopsy, which occurs after death. Other methods of diagnosis include EEGs, cerebrospinal fluid testing, or MRIs, but these methods are not always accurate because they look for very specific symptoms. The next disease we're going to look at is Cotard's syndrome, otherwise known as walking corpse syndrome. People affected by Cotard's syndrome believe they are dead. They may even think that parts of their body are missing, or they're dying or don't exist. They might believe that nothing exists. Cotard's syndrome is extremely rare, with less than 200 cases reported worldwide. It's not clear what causes Cotard's syndrome. However, we do know that it is not a disease on its own. Rather, it's typically a symptom of another overlying neurological problem. Cotard's syndrome is known to result from dementia, encephalopathy, or infection of the brain, epilepsy, migraine, multiple sclerosis, Parkinson's disease, stroke, subdural bleeding, or possibly a combination of different types of brain damage. Cotard's syndrome can affect people of all ages, ethnicities, and backgrounds, but it most commonly affects people in their 50s. Many patients have underlying mental health problems, such as substance abuse, depression, anxiety, or schizophrenia. Many patients also have some sort of damage that will show up on imaging tests, like blood clots, a stroke or tumor, or some other form of brain injury. Symptoms of Cotard syndrome include overwhelming feelings of being dead or not existing. As a result of these feelings, patients may fail to take care of themselves. There have been reports of patients harming themselves or starving themselves due to the point of malnutrition. They may believe that their organs have stopped functioning. Some patients stated that they thought they smelled like rotting fish. One woman with Cotard syndrome even asked to be moved down to the hospital morgue because she thought she belonged with dead people. Cotard syndrome is easy enough to diagnose because the symptoms are so unique. However, because it's a symptom of another condition, it's not always easy to treat. There are no firm guidelines for doctors to treat Cotard syndrome, but the first step is always to treat the overlying condition. Additionally, many patients respond well to antipsychotics, anti-anxiety meds, or antidepressants. Other patients do well with a combination of medicine and therapy. Electroconvulsive therapy is a last resort. This treatment involves sending small electric shocks throughout the brain, but it can have severe side effects and should only be used when all other treatment methods have failed. Cotard syndrome is a great example of a disease that is almost too rare to study. Because there are less than 200 cases worldwide, it's difficult for doctors and researchers to determine exactly what causes the syndrome and what areas of the brain are affected. Thankfully, the disease itself is not life-threatening as long as the symptoms are managed properly. Our next disease is rabies. Many of you have likely heard of rabies, even if you don't know what the disease does. If you've ever heard an adult warn you to stay away from animals like raccoons or stray dogs that are frothing at the mouth, they were cautioning against rabies. Rabies is a deadly virus that is spread to people through the saliva of infected animals, usually through a bite or a scratch. The most common animals to spread rabies to humans are bats, raccoons, skunks, foxes, and dogs. Bats are the most common spreader, accounting for up to 70% of cases. Dogs are the least common, mainly because dogs are required to be vaccinated for rabies in the US. However, any mammal can become infected with rabies. Cases of rabies in humans are extremely uncommon. There are maybe 2 cases in the US every year. After the rabies virus enters the bloodstream through a bite, it must travel through the body to the brain before it can cause symptoms. This process, called the incubation period, can take hours, days, or even weeks. In humans, rabies must be treated during the incubation period. Once symptoms appear, the disease is nearly always fatal. Rabies operates similarly to other viral infections. The virus cells, which are classified within the Rhabdoviridae virus family, are absorbed or fused to the host cells, or nerve cells. The virus essentially breaks into the host cell and infuses it with virus RNA, therefore using the host cell to replicate itself. Virus replication in the salivary gland of the host animal, along with the aggression that results as a symptom, is how the virus ensures that it will be passed on to infect a new host. The first symptoms of rabies are general weakness, headache, and fever. These symptoms can appear very similar to the flu, which may make diagnosis difficult. The initial symptomatic period can last for days, during which the area of infection will start to become uncomfortable and itchy. Within days, mental symptoms develop, including insomnia, anxiety, confusion, cerebral dysfunction, hallucinations, and hydrophobia, or fear of water. This is known as the acute period of the disease and usually lasts between 2 to 10 days. Other symptoms of rabies include trouble swallowing, sensitivity to light, excessive salivation, muscle spasms, aggression, and seizures. Once the first symptoms of rabies appear, no matter how nonspecific, the disease is nearly always fatal. Other than comfort care, very little can be done for the patient. This is why it's essential to treat a possible rabies infection during the incubation period. Thankfully, rabies is fairly easy to prevent. The best way to avoid contracting rabies is to avoid rabid animals. You can't always tell if an animal is rabid just by looking at it. In fact, the only conclusive diagnosis is through post-mortem laboratory testing. However, there are some signs and behaviors to watch out for if you encounter a wild animal or dog you don't know. These include general weakness or sickness, problem swallowing, lots of drool or saliva, an animal that bites at everything, an animal that seems oddly tame, an animal that has trouble moving or can't move at all, or a bat that's on the ground. Bats are especially important to avoid when it comes to rabies. They're the #1 spreader of the rabies virus in the US, mainly because bat scratches or bites may not be large enough to notice. If you're ever bitten by a wild animal, especially if it was symptomatic, seek medical help right away. The last disease we're going to talk about today is called fatal familial insomnia. FFI is a rare genetic degenerative brain disorder and is classified as a transmissible spongiform encephalopathy, just like CJD. FFI is characterized by insomnia that quickly worsens to the point of fatal sleep deprivation. FFI is another type of human prion disease. It's caused by mutation in the prion-related protein gene, or PRPN gene, which is the gene that regulates the production of the prion protein in the body. The mutation causes the protein to become misfolded and therefore toxic to the brain. In FFI, the misfolded prion protein is usually found in the thalamus of the brain. The thalamus is responsible for regulation of basic functions like sleeping, appetite, and body temperature. As this misfolded protein builds up, it destroys nerve tissue, causing a sponge-like appearance within the brain. Sometimes, the protein will destroy other nerve tissue as well, primarily in the autonomic nervous system, which is responsible for maintaining involuntary functions like breathing and heart rate. FFI is a genetic disorder, meaning that it can be passed down from parent to child. It is inherited in an autosomal dominant pattern, so it only takes one parent to pass down the mutant gene. In very, very rare cases, FFI can occur sporadically without a family history of the disease. This form of the disease, called SFI, has only affected about 24 people in medical history. The standard genetic form of FFI is slightly more common. Prion disorders in general affect about 1 per 1 million people worldwide every year, and genetic prion disorders make about 15% of these cases. In other words, FFI is so rare that there is not a quantitative estimate of how many people have ever been diagnosed. The main symptom of fatal familial insomnia is, as you might have guessed, insomnia. The insomnia may first appear to be mild, but progressively worsens until the patient is getting very little to no sleep. Lack of sleep leads to significant mental and physical deterioration. Mental deterioration can include progressive dementia with worsening problems with thought, cognition, memory, language, and behavior. Patients may also experience unexpected weight loss, forgetfulness, inattentiveness, problems concentrating, or speech problems. Hallucinations are also common as a result of lack of sleep and can be visual, auditory, or tactile. In addition to problems that arise from lack of sleep, many patients experience double vision, nystagmus or abnormal eye movements, problems with swallowing, slurred speech, trouble coordinating movements, which is called ataxia, and myoclonus, or twitching movements. Additionally, if the disease affects the autonomic nervous system, patients may experience fever, tachycardia, high blood pressure, increased sweating, increased production of tears, and variations in body temperature. The disease usually progresses over the course of a few months. Most patients live for 6 to 36 months after symptoms begin. Ultimately, lack of sleep leads to coma and death. There is no cure for FFI, and because it's so rare, there have been no drug trials to test for possible treatments. Currently, the only options are comfort care and symptom treatments, like seizure medications to treat myoclonus. Whenever a case of FFI is diagnosed, doctors typically screen the patient's family members as well due to the genetic component of the disease, and psychiatric support for the entire family is encouraged. I hope you've enjoyed learning about some rare neurological diseases with us today. As scientists, it's very important for us to study diseases, no matter how uncommon they may be. These diseases tell us a lot about the areas of the brain they affect, how diseases can pass from animals to humans, and genetic inheritance. Research is currently underway to understand the 4 diseases we talked about today and to attempt to find improved treatments. With time, hopefully we'll be able to find a treatment or cure for these diseases, as well as many others.